Hi, my name is Judy Moreno. I'm an F&P student from Simmons, and I will be doing a physical assessment today. How are you?
I'm good.
We will begin with the musculoskeletal system, okay? I will check your temporomandibular joints. I do not see any deformity. I'm going to palpate. Let me know if there's any tenderness.
No?
There's no tenderness or masses
No.
on your TMJ. Now can you please open your mouth, extension, and then close? That's flexion. Good. Range of motion is full. There's no limitation or hesitation. We will check your cervical spine. There's no deformity or any masses or any inflammation. I'm going to palpate. Any tenderness?
No?
Good. There's no tenderness. There's no masses or nodules. Can you please bring your chin to your chest? Flexion. Look up. Extension. Look over your shoulders. Lateral turning and the opposite side. Bring your left ear to your shoulders and the opposite side. Lateral bending. So the range of motion is good. Now I'm looking at your shoulders. There's no any asymmetry or any deviation both anteriorly and posteriorly. I'm going to palpate the sternoclavicular joints, the clavicle, the acromioclavicular joint, and the glenohumeral joints, the bicipital groove, and the other side, sternoclavicular, clavicles, acromioclavicular joint, and the glenohumeral joint and the bicipital groove. Is there any tenderness with that? Good. Now we will check for the range of motion. Bring your arms to the level of your shoulders, abduction, across the midline, adduction, over your heads, flexion, and then all the way to your back straight, extension, and behind your ears, external rotation, behind your waists, internal rotation. Good. That's a very good range of motion for your shoulders. Now we will check for the elbows. Looking both elbows, there's no deformity or any inflammation. Going to palpate the epicondyle, the lateral and the medial, and the olecranon process. Let me know if there's any tenderness.
No.
And olecranon process. Good. There's no tenderness, no masses or nodules. Let's check for the range of motion. Bring your arms forward. Flexion, extend, extension, and then your palms up like that, pronation, and like that is supination. Good. Range of motion is full. Now looking at your wrist, there's no deformity, masses, or nodules. I'm going to palpate the bones. I do not feel any crepitus or any masses. Is there any tenderness?
No.
There's no tenderness. Can you bring your flex your wrist like that? Flexion, extension, and then interradial deviation and ulnar deviation. Very good. So the range of motion of the wrist is full. Now looking at your fingers, there's no deformity, no masses or nodules. I'm going to palpate the distal phalangeal joints, proximal phalangeal joints, and metacarpal phalangeal joints on each of your fingers. Let me know anytime you feel any tenderness.
No.
Okay, there's no masses. Okay. No tenderness.
No.
Or any nodules. Now can you make a fist? Flexion, extend, extension, fan your fingers, abduction, bring it back, adduction. Good. Range of motion of your fingers is good. Now I will check for your on your knees. Looking at your knees, there's no inflammation. I don't see any masses or nodules. I'm going to palpate. Tibial tuberosity, tibial plateau, and the patella is well seated. The tibial tuberosity, and the tibial plateau, and the patella is well seated. Can you extend both of your legs? Extend, extension, and bring it back. Flexion. Very good. The range of motion of your knees is full. Now I'm going to check for your ankles. There's no swelling or any deformity or any masses. I'm going to palpate your ankles, your Achilles, the medial malleoli and the lateral malleoli on both sides. Any tenderness?
No.
Okay, there's no tenderness or masses. I'm going to have you point your feet to the ground. That is plantar flexion, and to the ceiling, dorsiflexion, and invert. Very good. And evert. Very good. So range of motion is full. Now I'm looking at the toes and your forefoot. I do not see any obvious deformity, no nodules or masses. I see hypopigmentation of the skin, but there's no active inflammation or anything like that. I'm palpating distal phalangeal joints, medial phalangeal joints, and the metatarsal phalangeal joints on each of your fingers. Let me know anytime you feel any tenderness.
No.
Or causing you any distress. Okay, there's no masses, nodules, there's no tenderness. Can you please crunch your toes? Crunch your toes, flexion and extension. I'm going to ask you to invert. I'm going to support your sole. Invert, evert. Very good. Other side, invert and evert. Very good. So the range of motion of your forefoot and toes is full. This time I'm going to check for your hips. I'm going to ask you to lay down for me with your head that side for the sake of privacy. Okay. I'm going to palpate your hips. Feeling for your greater trochanters. Is there any tenderness?
No.
There's no tenderness. I do not feel any masses or nodules. I'm going to do some maneuvers and let me know anytime it's causing you any distress, okay?
Yes.
This is flexion, extension. Can you please lay to your side? Any tenderness?
No.
Okay, I do not feel any crepitus. Go ahead and lay back on your back. Go back. Okay. Okay. Internal rotation and external rotation. Okay, very good. Abduction, adduction. Are you okay?
Okay.
Okay, very good. So there is no tenderness. I did not feel any crepitus or any abnormality. Normally, I check both sides of the hips, but for the sake of time, I will just not do it at this time. I'm going to ask you to sit up for me and actually stand up. I'm going to check your spine now. Okay, I'm gonna pull your shirt up. I'm going looking at your thoracic area and lumbar. Okay, very good. I do not see any masses or any abnormal curvature of the spine. I'm going to palpate the lumbar and the thoracic, and then the sciatic notch on both sides. You okay? Any tenderness?
No.
There's no tenderness, there's no masses or any nodules. This time I'm going to have you touch your toes. Flexion, bend your back, look up. Extension, put your hands to your waist, to the side. Okay, lateral bending and look, rotate, lateral rotation, very good. The range of motion of your spine is full. Now I'm going to have you go back and sit down. That concludes our musculoskeletal system. We will now move on with the cranial nerves, okay?
Okay.
But first, I'm going to ask you some question. To check for cognitive function, I'm going to ask you to spell the word world backwards for me.
DLROW.
Very good. And what would you do if you're caught in a burning building?
I would immediately look for the exit and move away fast.
Very good. That tests for your higher intellectual function. Now we will check for the cranial nerves. I'm going to have you occlude one of your nostril and let me know what aroma you smell.
Mint.
Very good. Over the other side.
Coffee.
Very good. That's your olfactory. Cranial nerve number 1 is intact. Now we will check for the optic, which is number 2. Since you normally wear glasses, I'm going to give it back to you and cover one of your eye, okay, left eye, and I'm going to have you hold this 14 inches away from your face. Read the lowest line you're able.
LTFPH.
And cover the other eye.
LTFPH.
Very good. And now both eyes uncovered.
LTFPH.
Very good. It's your visual acuity is 20/20 on left, right, and both eyes. Now I will check for the visual field by confrontation. I'm going to have you cover your left eye while I cover my right eye. Okay, your right eye while I cover my left. That's fine. Okay, let me know when you see my hands coming in.
Yes. Yes. Yes.
Keep your eyes covered.
Yes. Yes. Yes.
Good. And now the opposite eye.
Yes. 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 Yes.
Very good. Visual field by confrontation using the six cardinal fields of gaze is full. That is cranial nerve number 2. It's intact. Now the oculomotor, I'm going to check for direct and concentral. Can you please look at me? Yes. Direct and concentral. Now direct and concentral. Very good. Cranial nerve 3 is intact. Both pupils constrict to light. Now we will check for the extraocular movement, but that will check cranial nerves 3, 4, 6, the oculomotor, the trochlear, and the abducens. I'm going to have you follow my pen light. Okay, stare at my pen light. Very good. Cranial nerve 3, 4, 6 is intact. There's no strabismus or nystagmus. Now we will check for number 5, which is the trigeminal. I'm going to check for sensory. Let me know if you feel soft or sharp. Close your eyes.
Soft. Soft. Sharp. Soft. 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 Sharp.
Very good. Sensory is full with the soft and sharp stimuli. Now I will check for the motor. Can you please look at me? That causes a brisk blinking. And that check for the corneal eye reflex, which is good. Now we will check for your masseter. I'm going to have you bite down on my tongue blade and don't let go. Okay, very good. And now the other side. Okay, your bite is strong. It is equal on both sides, about 4 to 5 plus in strength. Now we will check for the facial nerve, which is number 7. I'm going to have you close your eyes for me, and don't open. Good. And now open your eyes. Raise your brows, puff your cheeks, and smile, and frown. Good. Facial nerve is intact. Now we will check for the acoustic. Cover your left ear for me. Repeat the word.
Baseball. Baseball.
Good. Now cover the other ear.
Football. Football.
Very good. So the auditory acuity is intact. The whispered voice at 2 feet away from the ear. I'm gonna now check for the Weber and Renee test. Which first is Weber. Let me know if you hear it on one ear or both. Okay.
Both.
Okay. Since you said both, Weber test is full. It's intact. There's no lateralization. Now the Renee.
Yes.
Still here?
Yes.
Good.
Yes. Yes.
Okay, the Renee test is intact. Air conduction is greater than bone conduction. So that's cranial nerve 8, which is intact, the acoustic. Now for the next one, I'm gonna have you say ah. This will check the cranial nerve 9 and 10, the glossopharyngeal and the vagus nerve. Okay. Say ah.
Ah.
I see the uvula rises at midline with phonation. I'm gonna have you open again. Open. And there's positive gag reflex. Sorry about that. The cranial nerve 9 and 10 is intact. Now the 11th one is the spinal accessory. Can you shrug your shoulders against my hand? Good. The strength is about 4 to 5 plus, and it's equal. Same thing on the face. Good. Your spinal accessory is intact. Now the last one is the hypoglossal. Can you please stick your tongue out for me? Good. So your tongue protrudes at midline. There's no fasciculation or any deviation, which is good. Cranial nerves 12, which is the hypoglossal, is intact. Now that concludes our cranial nerves. We will move on to the motor. But first, I will make comments on your overall muscle bulk. I do not see any differentiation in sizes. I do not see any deformity or any fasciculation or tremors, which is good. I'm going to have you walk forward And when you walk back, can you heel to toe when you come back towards me? Go ahead. And come back. Heel toe. Okay, very good. I see that your gait is smooth. It is well coordinated with good arm swing. Now, since you're standing up, I will check the pronator drift. Can you please look forward and bring your arms forward for me and palms up. Close your eyes. Here I'm monitoring for one or both of your arms dropping, or one of your palms pronating, which does not occur. You can open. There's a negative pronator drift, which is a normal finding. Since you're standing up, I'm also now going to check the Romberg test. Can you please close your eyes? Put your hands towards your side. Now I'm looking for any sway, which I do not see. That's a negative. Go ahead and open. That's a negative Romberg test. Very good. Now you may have a seat again. I'm going to check for the upper arm strength. Can you bring your arms up and push against my hand? And this one, push against. No, like your thigh. Good. And this one, and then down. Again. Your lower extremity, push against me. Very good. And your feet, push against and push up. Very good. So your strength is very strong. It's 4 to 5 plus. It is equal on both sides in both upper and lower extremity. Now we will check for the reflexes. In this test, I need you to try to relax your body as much as you can, okay? We will check for just let your arm dangle. Just let your arm rest on my hand. This is tricep. Very good. Bicep. Very good. And the radial. Very good. The patella. And relax your legs. Good. And the Achilles, I'm going to support your forefoot. Good. And I'm going to check for Babinski. I'm looking for there should be no fanning of the toes. I do not see that. Same thing on the other side. The triceps. Just relax your arm for me. Just let it rest on my hand. Very good. The biceps. Brachial radialis. Very good. And the patella. Relax. And then the Achilles. And now the Babinski. Very good. I do not see any fanning of the toes. So your deep tendon reflexes are 2 plus, and it's equal on both sides in both upper and lower extremity. Now we will check for your sensory, okay? Let me know if you feel soft or sharp. Close your eyes.
Soft, soft, sharp, sharp, soft, 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 sharp, soft, soft.
Very good. The sensory is full to light touch and sharp stimuli to both upper and lower extremity. Now we will be checking for the vibratory sense. Can you please close your eyes? Let me know if you feel the vibration and when it stops.
Yes. Yes. And stop. Yes. And stop. Yes. Stop. Yes. And stop.
Good. The vibratory sense is full. Now we will check the position sense. Let me know if you feel your fingers and toes are going up or down. Close your eyes.
Up, down, up, down, up, up, down, up, down.
Very good. The vibratory, position sense is full. Now we will check for the equilibrium and coordination. First, I'm gonna ask you to do a rapid alternating movements of your hands like this. Okay, very good. And can you flap your feet? Alternate. Okay, very good. You are able to do the rapid alternating movement on both upper and lower extremity with accuracy. So the equilibrium and coordination is intact. And that concludes our physical exam. Thank you.